Welcome to Notre Dame, everybody. It's just so wonderful to have you here. It's an honor to host this summit here on our campus. And this summit is so incredibly important. It's really core to our mission here. We espouse to a disciplined sensibility to the poverty, oppression, and injustice that burden the lives of so many.
I think the poverty initiative here at Notre Dame has the right set of priorities for taking this on in partnership with all of you. The fact that there are people from multiple states here is a good sign for what the future has in store.
The opioid crisis is nothing less than the calling of our generation. But to those of us who are in the space, who are at the bedside, who are struggling to solve these problems, we don't see numbers. We don't see just unique data. We see faces.
The fact that strikes me the most is that between 1999 and 2021, there's been about 1 million deaths from drug poisonings. If you were to total the total number of US soldiers that have died in all military conflicts since the Revolutionary War, it's about the same number. And so it's on the scale of armed conflict that our country has faced.
We think about family as providing love, support, and stability, but when addiction infiltrates this unit, it acts like a contagious disease, spreading dysfunction and despair. And children are really the most vulnerable victims.
This has touched everyone in our state. And so, we've all had to bury family members.
And there are not enough studies in the recovery space. And how can we support academic universities to study these very important programs to making sure that our communities, our families stay in long-term recovery?
If you're not tracking the data and understanding how this crisis is evolving, we won't be nimble enough to respond to it and be effective.
States and local governments are going to hopefully use those resources in a meaningful way to try to decrease the damage that has been done.
Another important component of this is the emphasis on using evidence to inform how we spend these resources.
The solutions to poverty aren't necessarily going to come from the academy or come from the government, but they're going to come from the people that are actually on the front lines in fighting poverty.
So we talked about stop using stigma, call it what it is, naming examples of discrimination, because there's shame in asking for help because these things up here still exist.
And you have a cacophony of voices here at this conference. And hopefully this is the beginning of a new wave of approach, not just talking, but getting doers together.
We must understand that the opioid crisis is a complex, multifaceted issue that requires a coordinated response from all sectors of society.
We believe firmly at Notre Dame that evidence is key, and evidence has got to be included into the discussion. And so our goal is to make sure we together create evidence and we together ensure that evidence gets put to use, not because of a brilliant research agenda, but because we too care about the lives of people struggling in poverty and the lives of people impacted by this horrible epidemic. And we want to make sure we bring our tools to the table, which is evidence creation.